COVID-19, the most unprecedented health crisis in recent history that has claimed the lives of over 2.1 million Europeans.
Well, in Poland, this month we made a survey when we asked about the health problems that the patients are afraid. And the COVID was almost the last one. Only 7% Polish patients said the COVID is a problem for them. But we know this is a serious problem, and we cannot forget about the COVID, because maybe pandemic is officially stopped, but the problem is still relevant.
One of the virus's most terrifying characteristics was how quickly it overwhelmed health systems all across the EU. Hospitals were underprepared, understaffed, and understocked. On May 5th, 2023, the WHO declared the end of the emergency, but at the European Parliament, on the 14th of November 2023, patient groups gathered to beat the drum on behalf of those to whom COVID-19 still poses a dangerous risk.
Thanks to the initiative promoted by Active Citizenship Network, the European branch of the Italian NGO Cittadinanzattiva, 26 patient advocacy groups from several member states sent a clear message to the European institutions linked to the need to reinforce effort in order to minimize the impact of COVID-19 and its variants. So we are talking about patients with immunocompromised people, patients living with comorbidities or with respiratory disease, cardiovascular disease, oncology patients. In order that, and in addition, we have also to say that the respiratory disease in this period causes a lot of hospitalization. Elderly people, but also people with comorbidities.
Over 2 hours, experts outlined 10 policy recommendations which included continued investment in e-health, helping healthcare professionals keep up to date with the latest COVID-19 treatments, strengthening the role of pharmacists, and ensuring the virus stays at the forefront of national health policies. Another recommendation is about guaranteeing equitable access.
I think equity is really the word that we need to consider, especially because of the discrepancies. And I think that the EU has a very big role to play there in ensuring sharing data, not having every single country redoing what another one has done, and supporting, so the EU supporting the different countries, so the access to diagnosis, treatment and care should be as equitable as possible.
The forum was also an opportunity to unveil the Care for All social media campaign that supports the recommendations for high-risk patients. But patient groups can only do so much. With a new election cycle looming, will healthcare remain a priority for politicians?
We will not abandon the point, and we will continue pressuring the Commission. I agree that it has been a bit disappointing in this aspect, this last speech. But I'm sure that the Parliament will stay vigilant, that steps are taken forward and not backwards on what we need to do. I listed many different aspects in this sense. This means debates in plenary, this means parliamentary questioning, it means having occasions like this to mobilize. And we need the Commission to be held into account for this, because it's clear that after what happened, after what was announced, after what was done, there needs to be a delivery. It needs to be a step forward in building a stronger health union for these objectives that we just described.
COVID-19 may well be in the rearview mirror for the majority, but here at the European Parliament, the message was clear. Patient groups want to continue to fight and give voice to the most vulnerable amongst us. They want to speak to power and ensure that high-risk patient healthcare pathways and infrastructure are improved so that a future health emergency may never again cripple healthcare and leave the most at risk fighting for their lives.